Hello, this is Dr. Steele. Today I want to talk to you about non-alcoholic fatty liver disease, and most of us known as fatty liver. So what does that mean? That unfortunately, the liver fat accumulates within it that comes directly from the diet. So just to remind you, every time we eat, the food needs to go from your mouth, your esophagus, your stomach, to your small intestine, all the way down is being broken down into little pieces. And from the small intestine, the nutrients, the foods, meaning the proteins that turn into amino acids, the fats that turn into fatty acids, and the sugars that turn into glucose, they need to pass through the first filter of your body, your liver. And the thing about the liver is that it's surrounded by a very thick capsule. And when we eat things that have a lot of sugar, especially things that come from high corn fructose syrup, some of that sugar turns into fat. And most of it goes right through your liver. But eventually those little droplets of fat are going to grow. And if they grow large enough, it's going to start pushing against the normal cells of your liver. And if that happens long enough and those droplets continue to grow of fat, then those cells that are helping us purify our food and metabolize the medications or any substance that is going through it, then those cells are going to get damaged because they're being squished. It's because they're getting pushed around, pushed to the side. And the analogy is that what happens when you squeeze a tomato more and more and more, well, certain fluid is going to come out of that tomato. The same thing happens to those liver cells, that the more they're being pushed to the side, they're going to be liberating or releasing liver enzymes. And that tells us that the liver has inflammation. And that inflammation, if it happens long enough, is going to turn into fibrosis of the liver. And fibrosis, if it happens long enough, which is scar tissue, that's what we're going to call cirrhosis. So non-alcoholic fatty liver disease is derived from our diet. And because of that, most of us that eat a diet that is exposed to a lot of fake food meaning things that are not real, as I explained before. Fake food meaning things that don't grow on trees, things that you cannot find, you cannot dig out of the ground. For instance, Twinkies, pastries, cookies. I mean, you've never seen a cookie tree. You have never seen a Twinkie tree. Cheetos, etc. All those foods that we create that are called junk food, that are foods that are high in high corn fructose syrup and other sugars, are going to promote fatty liver. And those same sugars are promoting for patients to be diabetic, for them to be obese, for them to have cardiovascular disease, for them to have problems with cancers and other ailments, because unfortunately those sugars are making our body release more insulin. And when we release more insulin, we create something called insulin resistance. And that insulin resistance is also affecting the liver in many different ways, metabolically speaking. So my point for today is, not only do you need to eat better to delay or prevent this entity, this condition, but also you need to be aware that the more we grow, in other words, in age, is the more and more importantly for us to eat healthier. It's not the same to be 20 eating garbage, junk food, than when you're already 50. Because even though we still psychologically feel that we're still young, our body's not young. So my talk for today is recognize this entity. Know that even though you may not have inflammation, if you have extra weight, if you have diabetes, if you have even women when they have polycystic ovarian syndrome, all those symptoms that are linked to obesity and eating the wrong food, the only way we can delay the presence of inflammation of the liver or cirrhosis is to change our lifestyle and avoid foods that we know are fake. Well, that's my talk for today. Remember what I always say, the greatest wealth is health.